in the middle of Breast Cancer Awareness Month, and today we're talking prevention and what to do if you get a diagnosis. Dr. Christina Weed, breast surgeon at the Overlake Cancer Center, joins me now. Thank you for being here.
Thanks for having me.
So first, when should women be getting screening done for something like this?
For most women, screening starts at age 40, and screening is a mammogram. Once a year, every year, easy enough.
It is easy enough.
Yeah.
What if, though, you have family history or something else to think about? Should it be earlier than 40, or is 40 still okay?
So for certain women, there's risk factors that put you at increased risk of breast cancer over your lifetime. And for those women, we recommend starting screening a little bit earlier. And it's a variety of factors. It could be breast density, family history, having a biopsy before. It's something you should definitely talk to your doctor about. And it could also include additional screening like MRI.
Yeah.
Yeah.
Everyone's always a little apprehensive about getting it. Like, I'm not 40 yet, I haven't gotten it, but I might get it before because why not?
Yeah.
Any tips or feelings, or just, hey, this is what you have to do and it'll be fine?
Just do it.
Just do it.
Yeah, take control of your body a little
Exactly.
bit. Just get it done.
Absolutely. If a patient has been diagnosed too with breast cancer, what are the next steps? What does that look like?
Right, so that's when a whole team kind of comes into play. And so once you're diagnosed with breast cancer, you start meeting a lot of people, making a lot of appointments. One of the things that's nice about Overlake, where I work, is that we have a whole multidisciplinary team, and we coordinate your appointments so that you meet everyone on the same day. Usually that starts with a phone call from our nurse navigator, who's kind of like your lead point, and she tells you where to be and when. Makes those appointments for you. You're not stuck on hold, at the doctor's offices, and you're gonna meet the radiation oncologist, you're gonna meet the breast surgeon, you're gonna meet the medical oncologist, nurse navigator, social worker. I could go on. So you're gonna meet a whole team of people, and then, hopefully at the end of that day, you walk away knowing exactly what your plan is moving forward.
That's so great. And almost having that project manager, like you said, to be able to navigate all those things so people do so much better when they have a plan and know what to expect. So walk me through Overlake Supportive Care Services as well. This is really cool what you guys do.
Yeah, so, life doesn't stop with a breast cancer diagnosis. Life goes on, and so we have to start thinking about what life looks like afterward. And so there's this new-ish field called survivorship. And so all of the treatments and recommendations that we offer for breast cancer have side effects. And so think about massage therapy, mental health, and we have a mental health counselor who helps people with sort of like the anxieties and sort of, the mental aspect of having a breast cancer diagnosis. We have physical therapists, we have occupational therapists, all kind of services to kind of help you move on with your life after breast cancer.
Definitely. And I know it's also hard, when my dad was diagnosed with cancer years ago, it's like just having that support system as well for families is also so important.
Yes.
What are some prevention strategies too that anyone can take and start thinking about?
Yeah, so I always start with exercise. Exercise is good for a lot of parts of health, but for breast cancer in particular, what I tell my patients is that if you had a twin and you exercised and your twin did not, your risk of breast cancer is lower than your twins just because you exercised. And so I always encourage people to do 150 minutes a week. It can be spread out as much as you want, of like moderate intensity exercise. So like a little bit breathy, so you couldn't like sing a song, but you could have a conversation. And then a couple times of weightlifting a week. That's like a great exercise routine. Easier said than done, but it's something you can do to prevent breast cancer or decrease your risk of breast cancer over your lifetime. Other things like maintaining a healthy weight, limiting alcohol, avoiding smoking, those sorts of things. But I always start with exercise because it's a little bit more action oriented and people kind of feel a little bit more empowered to do it.
To make a change. Is there any like particular diet too that's helpful that you think, or is it mainly just to focus on like your BMI and making sure your weight's at a healthy weight?
So diet, I say, avoiding super processed foods, but just variety. You know what I mean? Like eating a little bit of everything, balance is key. And like the BMI is a little bit tricky. I tell people healthy weight and BMI is, I think a little prickly for some people. And so I say a healthy weight for you is something that you feel good in your body. You're able to do the things you want to do. You're able to exercise, chase your kids around, those sorts of things. That's usually a healthy weight for most people.
I like the way that you describe that. Thank you. I know, because BMI can be prickly.
Yeah.
How can people go learn more about Overlake's Cancer Center programs?
Our website is a wealth of information. We have our cancer services website, just on overlake.com. You can navigate to that and get a lot of information there. Yeah.
Any last thoughts that you want viewers at home to know, and especially since this month is Breast Cancer Awareness Month?
Just that breast cancer is super common. 1 in 8 women in their lifetime will be diagnosed with breast cancer, so you're not alone. And it's also just a great reminder, because it's so common, to get your breast cancer screening, because if it's caught early, it is so curable, and people do great with sort of modern approaches to breast cancer care.
So once a year, get in and get it done.
Yeah.
Thank you very, very much for being here.
Yeah, thank you for having me.
And again, for more information, just visit the website that you see on your screen, overlakehospital.org/services/cancer/care.
New Day Northwest is sponsored by Overlake Medical Center and Clinics.